just a few short months after the outbreak of this new coronavirus SARS-CoV-2, and while the world buries thousands of people every day, friends, family, loved ones, China, backed by the World Health Organization, has reopened wet markets across China and even in Wuhan itself, which was the source of this new coronavirus and the very start of this COVID-19 pandemic. Now, personally, I think this is very dangerous, irresponsible, and not to mention insensitive, while the rest of the planet continues to fight and reel from this microbiological onslaught, which should and could have been avoided. These wet markets are the very source of spillover events that lead to the emergence of new zoonotic pathogens, that's viruses, bacteria, and microbes that jump species to infect humans from animals. Although China has imposed a ban on the trade and consumption of wildlife, in such places where so many diseases have been unleashed due to this unusual interspecies contact, I think it's nothing short of irresponsible not shutting them down for good. There is now alarming new evidence that the Chinese government are promoting bear bile as a treatment for COVID-19. This medicine, Tan Ri Qing, comes in the form of injections using bear bile powder and is a total contradictory stance to protecting wildlife. Bear bile from captive bears in China is legal, although the import of bear bile from other countries and bile from wild bears is banned. But the Environmental Investigations Agency first heard about the Chinese government's recommendation for this treatment for COVID-19 from illegal traders. Reports now suggest that illegal bile from bears is produced in China and is also imported from captive and wild bears in Laos, Vietnam, and North Korea. It's certainly therefore a worry that the use of these Tan Ri Qing injections will increase the demand for wildlife products, and there is a preference among consumers for the wild product or the real deal. So having this legal market with captive bears doesn't reduce the pressure on wild populations. In fact, it maintains the demand and drives poaching. At bear bile farms in China and across Southeast Asia, the animals are kept in very small cages, sometimes for decades, and bile is routinely extracted by inserting a catheter or syringe into the gallbladder. Now, this process is extremely invasive and causes a lot of pain and suffering for the animals. And these bear bile farms are often rife with neglect and disease. So consumers are also at risk from ingesting bile from sick bears, which is often contaminated with feces, blood, bacteria, urine, and pus. Another approved medicine which could be in demand to treat COVID-19 in China and throughout Southeast Asia is a pill called Angong Nuhuan Wan, which treats fever and various diseases and traditionally contains rhino horn. Now, rhino horn is banned globally, and the Chinese government say that buffalo horn should be used instead. However, some traders are still touting pills with rhino horn. Now, this just has to stop. And we really do need to call on governments to ban wildlife trade and wildlife markets. These wildlife markets are also a threat to biodiversity as they encourage poaching and the capturing of wild animals.